I had 2 or 3 clients look at me as they're sipping on their bendy straw and their water. It's like, why is everybody so freaked out about labor? It's actually pretty boring. You just wait for the next pressury thing to start, and then you focus on your breathing till it's gone, and then you do it again. If only everybody could approach their labor with that mindset that it's not that big a deal.
Welcome to the Birth Education Center podcast, hosted by myself, Care Messer, an entrepreneur, birth educator, and doula. My team and I want to help you discover your options in birth and postpartum, how to find your voice, and how to use that voice to navigate our maternal healthcare system. You and your baby are not just a number. This information includes doulas too. Now let's get started. I have Jenny West back on the show today, and Jenny's the midwife from New Mexico, if you didn't see our part 1. And today I thought we would piggyback a little bit on the fear episode as we're learning how to breathe when we're getting pieces of information that we are unsettled with or that are new and unfamiliar to us. I wanted to go into the breathing and how we teach breathing and what it really means when we're teaching breathing, because inevitably every single time, even though we spend a whole class talking about the breathing, we practice it. And I check every single week during the whole series. Are you practicing? Do you have any questions? There's inevitably 1 or 2 couples who call me a couple weeks later going, I just don't have the breathing down. Like, I think I'm doing it wrong. They're so in their head about it, which I remember being the same way. So we walk through it. They do have a video that they can go back over it with, and still, how am I breathing? And it has to be correct. There are a million different types of breathing, tons of teachers that teach it. I know that you've already gone onto YouTube and checked it out, and there's 17 different ways. I know you've read 15 different books about breathing and have practiced all of those. We're going to try and figure out what works for you, because in labor, it's always different and it's going to change throughout labor. But there's no wrong way per se to do it unless you are hyperventilating. Let me give you a little story about that. Jo Kilburn and I, she's another doula and an educator, went to a childbirth education training to better our skills. And the second day of the training, she put little brown paper bags on all of our place settings. And when I see a brown paper bag, I think it's going to have food in it, like it's snacks, like it's a lunch sack, right? And as we were sitting there, somebody asked, hey, what are these little bags for? Are they for treats for the parents? And she said, oh, no, you got to make sure that those parents put those in their birth bag. That's for when they hyperventilate. And Jo and I looked at each other and I'm like, have you ever had parents hyperventilate? She said, no. And I'm like in all your years, I've never. She's like, no. And so we were so confused by that. And I said, I'm going to ask her about that. She's like, don't, you'll sound stupid. And I'm like, I'm going to sound stupid. And I said, can I ask you how and why they hyperventilate? And she goes, oh, it's very common as they're doing breathing. In fact, it happened to me in labor. I had a brown paper bag over my head as we were walking into the hospital because I was hyperventilating. And I got this visual of this grown woman with a big belly and a brown paper bag over her head, clutching it to her neck, walking into the hospital, hyperventilating during labor. And she thought that was normal. And maybe it was in old school Lamaze days. I have never heard of that and never seen it. So Jo and I did spend that lunchtime teaching everybody our breathing technique because we knew it worked, but I was so confused by that. So Jenny, have you ever seen anyone hyperventilate during labor? Like where they needed to huff into a paper bag?
The old paramedic in me is having a breakdown that you're going to include a panic driven device into labor. Talk about dismissing everything you've just taught them. Be sure you bring your paper bag. I would say, as a midwife, watching and listening to zillions of labors, if somebody's going to start breathing faster than might be beneficial, it's usually during true transition and maybe the first few true fetal ejection pushes that I have been known to say, slow down your exhale. And then I mirror it. I change my breathing so that they hear me. It looks corny. I feel corny that I'm doing so that they hear me exhale, because the brain is wired to do what you hear. We talk about it just like you. We talk about it during our prenatal visits, what true transition looks like. It's going to be the first time you look at me and say, okay, I don't think I like this anymore. I don't know what to do with this feeling. I don't know. And it's like, okay, that's probably the first time I really talk to somebody in labor. Their eyes are looking for an anchor. And that's when I'll say, this is what you've been waiting for. It feels big because it's big. It's feeling exactly as it should. Even when I'm talking about it, I sometimes feel like, okay, everybody's brain has already ricocheted into it can't be that simple. That taking a deep breath can change what's happening in my body and what I'm thinking. But the research shows over and over, if only we can remember to take a breath.
Well, and we're getting ahead of ourselves because we're talking about transition first, but
you asked me, that's the only time I really see sort of out of control, I haven't got this anymore, breathing.
That's exactly when I had the trouble with my breath, because you get that shot of adrenaline, like, okay, it is time, and your body panics because you're like, it's too big, it's too big, it's too big.
I don't know if your body panics, but your brain does, which then sends signals for your body to go, wait, we're not doing this right.
That is right when I went, I can't do this anymore. This is, whoa. And I stopped and I was ranting and my doula looked at me and all of a sudden that's when the surge hit. And it hit when I didn't have a breath in and it about knocked me over and I struggled. It was so painful for that full minute. I struggled with my breath and my doula was just, she taught me how not to be a doula, guys. So I'll tell you about her later. But she looked at me and goes, how'd that work for you? I was so angry in that moment. I was like, ooh, Dr. Phil me, you know, I was so mad. And I said, it was too much. And she goes, so what we were doing was working. So I'm going to start the light touch again, start taking a breath, close your eyes. Like she coached me back into it. And that's good because they were a minute apart at that point. They went back to back because it was transition. And yes, I went right back into that long, slow, and deep breath as best I could. I would say it was more rhythmic at that point. And I was still trying to fight off the anger because I wanted to haul off and hit her. But that's what got me through that point. So yes, I can see where that research is real. Take a deep breath, reset yourself, which is why when you're in fear mode, 4 deep breaths. All right, so let's start with the way we start teaching breath is how we're trained in hypnobirthing is that cleansing breath for baby, just to kind of reset your body, tell your partner, hey, it's starting, everyone pay attention to me. And then those long, slow, deep breaths until that surge is completely gone. And then I take another hydrating breath for baby to kind of give them some recovery breath. And then we just go about our business. And it's a pretty simple process, but in many of the books, including the hypnobirthing book, it gives numbers. Numbers did not work for me. Yes, they were a good distraction for my brain at first when I was practicing to kind of let me know what I was doing, but they hang me up because I like even numbers. They were odd numbers mixed in with that. Didn't work for me. It works for some families, but most of the families don't count. After they get the hang of it, they don't count. So in midwifery and with your teaching, what are the touchstones that you cover when it comes to breathing, between science, between energy, between whatever is going to work during an actual labor?
Good question. Because sometimes it's so simple and other times it has to be so adjusted. Because think about it. When you're laying in bed, listening to your visualization, whatever that is, or you're sitting in your favorite chair, that's not labor. Of course, it's practice. As instructors, as midwives, as birth workers, we can say, well, of course, you got to practice this a little bit so it feels more automatic during labor. So I watched my students struggle with this. I struggled. It's like, okay, we got to breathe into the count of 4, breathe out to the count of 8, whatever all the instructions were. I could do it for about 3 breaths, but then I was breathless. I got to catch up so I can do that weird combination again. It was not automatic for me. I had a client though that did yoga And when she heard that the perfect breathing was to inhale the whole time your contraction, your surge is building, pause, and then exhale the whole time. It's like, okay, that's a 30-second inhale and a 30-second exhale. But I was like, good on you for trying. That's your goal. That's where you're working towards. You're going to have no trouble with slow breathing, whether you actually match your contraction pattern or not.
And I had one mom who was a deep sea diver, and she took that on as well. She's like, oh, I can totally do that. And I'm like, can you? Like, it was so overwhelming to me.
But let's talk about training and
absolutely
hydrostatic pressure, atmospheric pressure. She's in a category all her own.
And she's not scared of it.
Right.
Breathing was a second nature to her. It was like, oh yeah, I can totally do that. I'm like, good for you. The rest of us, no.
So the simplest thing that I tell everybody is stop counting, stop worrying about how long or slow. Just breathe first, just breathe. And of course, even that can be like, okay, I don't know if I can just breathe. So then I just give them the cue to pay attention to the feeling of their chest rising and falling. And then, yes, because I taught hypnosis, I can slip right into my FM radio voice while I'm talking to them about focusing on their breath, breathing in and breathing out. Once you stop being up here in your frontal cortex, it's so much easier to let the breath do what all this teaching has been about. And sometimes that takes a little practice, depending on how much your tendency is to get in an activated or agitated state. To put it in the context of labor, did the baby just drop down and now you've got a new level of pressure,
new sensations
that you didn't feel the last 2 or 3 surges or contractions, that now you're like, what's happening? Okay. One of the other sentences that floated through my brain was somebody taught that the oxygen is right there waiting for you. All you have to do is inhale. Your only task is to just inhale. That oxygen, that air is so excited. It can hardly wait to get in your body, support your muscles, support your blood, go through the placenta, keep the baby happy. First time I heard that, I was like, that's brilliant. That the oxygen can hardly wait. It's only waiting for you to inhale.
That's a good technique. When you were talking about, all of a sudden babies dropped into a new place and there's a different sensation going, sometimes those feel like all of a sudden you got hit and you're like, and it's just immediately more intense. And when you have that kind of a switch in labor, your new normal is going to be after 2 more of those. So what we're waiting for is those hormones to catch back up with your system. And then it will be, oh yeah, okay, I got it again. And you forget what it was like before. You know, it was a little less intense. But when you get hit with one of those, bam, like just to catch your breath and get through it, 2 more. And then the hormones will have caught up and you'll be back into your rhythmic thing. So yes, it's going to level up a little bit because it's got to get more intense to get the baby out, but it's not going to be that way for the rest of the time. And I think that's immediately we go, oh my gosh, oh no. And there's no need to panic. 2 more, just like that. Your hormones will catch up and we get back to normal.
Interesting, because I always offer that if you change position in labor, the surge, where you're feeling it, how intense it is going to completely change because you changed position. And I won't even get into, this is still true in a water birth. I can only imagine what gravity is doing when you're on a bed or on the floor or whatever, when you just change position because your midwife suggested it or your doula suggested it.
Right.
I always give them the prep. This is going to feel like I'm insane for suggesting this for 3 contractions. And then you're going to go, oh, wait, okay, this is hurting my back less. This is better. Maybe we need to make a rule of 3 contractions when you change position or there's a shift in hormones. That can you tough it out for 3 and then reevaluate? Do I want to stay in this position? I always like that the water allows you to shift. I can't tell you how many women I see in birth get into like the runner's position. They're on their knees, they're leaning over the edge of the pool, but mid contraction, one knee comes up and they put one foot on the floor of the pool. The midwife in me is so validated that it's like, okay, they're listening to where the pressure is in their body mid surge and adjusting accordingly. The baby is saying, I need a little more space for my forehead over here on your right hip. That's what the baby's asking when they put their leg up.
That Captain Morgan pose. I love it.
Yeah. And sometimes they stay there and sometimes the leg goes right back down before the next surge happens. I don't know. One of the reasons I'm such a promoter of water birth is that allows the person who's birthing to just completely listen to the signals that they're getting, not to mention removing 75% of gravity.
Well, and how do you teach them to not feel what is right? Like get out of the smarty pants man in their head, her smarty pants woman, whoever it is in their head about the right breathing, because we can teach in and out through the nose because it gets more oxygen in. But then if you have a cold, that's not going to work. You know, if it's allergy season, you have a stuffed up nose. How do you get into that rhythmic breathing? Because that's really all that you need.
I probably get an F. I teach a lot of words about breathing, but I suspect we probably have to ask some of my clients. I'm trying to think if I've had a client that was in a panic about breathing.
Well, let's talk about chest versus belly breath. The shallow breathing that can be where they're nervous and they're telling their basic nervous system, somebody's chasing me. This is not right. Instead of long, slow, and deep, where like I'm in control. Everything's going according to plan. These are big feelings.
I probably get an F on that one too. The only time I've ever said, I want you to breathe slow and deep enough and push your belly out. I tell them to belly breathe. I don't know. We know we got to have group dynamics, that there's people who never read the book, never practiced, never did anything, and yet we're having a baby today, right? There's the people who come to class 3 times, or at least in my practice, they're welcome back anytime. I don't know. Maybe it's because I don't pack a brown bag in the birth kit. Nobody's in a tizzy about how to breathe. Maybe I've addressed it enough in class and at the home visit that they've relaxed about it.
Well, and maybe it is different when you've got that one-on-one with a midwife, but even my moms that did not take any classes, I'm going to be servicing their placentas. They will ask me questions as an educator, like, how will I know how to breathe? What kind of breathing should I be doing? I have done yoga, but you know, like they've never taken a class. So they're just in their head about breathing.
So apparently I become a smart aleck. If somebody said, how will I know how to breathe? I'm going to say, you've been breathing since the day you were born. You're already an expert on breathing. As your labor progresses, you're going to figure out what works for you. We know that panting makes you lightheaded. You've heard that slow, deep, and easy is the test answer. Somewhere between there is you're going to find out what works for you. If they have a support person, that's usually when I look at them and say, you may have to pattern slower breathing for them or deeper breathing. Now that I'm saying this, I have, back in the very early days before I was doing water birth, I have been known to put my hand on the top of the fundus to say, can you breathe down to your hand? When I learned hypnosis, I would tell them, put your hand on your chest, on your sternum. If they're just, I don't know what to do with any of this, then I tell them, I want you to breathe into the hand on your chest. Because breathing down to your belly's too much in one breath. Talk about triggering, I'm not doing this right. So let's just breathe into your hand. Feel your chest rise and fall. That's it. You got it. Do a lot of validation. Perfect. You've got this. Okay. The other thing is back to this breathing what's familiar and what's comfortable to you. Throw the numbers out the window. Back to my example that I could do 4 and 8, but I had to catch up. Defeats the purpose. So start where you are. And if that's just a shallow chest breath, so what? Do what's comfortable for you. And if your brain is still stuck on counting and that's 2 in and 2 out, great. Let's start there.
One thing you told me once when I had somebody that was kind of panicked about breathing and she just could not get out of her head is you said, it's very simple. Have her breathe to where her lungs are at full capacity as long as it's comfortable. And it was so simple. And the word comfortable as full capacity as is comfortable for you. And when I said that, she went, oh, okay. And it like decompressed the whole situation. And that's all she did. She would just breathe until it felt comfortable and then let go. It was the simplest technique. And I got that from you.
Oh, thank you. And yeah, back to logic, and it's so deceptively simple. Maybe that's why I'm having trouble answering all these specific questions about how many numbers and what do you do. And it's, you just breathe. And when somebody's panting or somebody's holding their breath,
or clenching their jaw, which is clenching their cervix.
Back to watching their labor. I'm surprised when I travel and cover another practice. And again, I'm not sure what I'm teaching or what's going on, that I'm learning that my clients overall are more towards the very quiet and focused end of the spectrum. I was shocked last year how loud and screechy, and I need earplugs to go to a birth with these people who don't have the same training that I give or classes. It's like, what's going on here? That volume is of value. Because yes, I was taught that if your neck is tense, if you're tense in your voice, you've clenched everything you own, including your cervix.
And if it's tight up here, it's tight down below.
That's right. Wrong direction. Of course, I've seen people in a moment of, I don't like what I just felt, and fall into that. Wait for it to pass, and then we start talking. I want you to put your hand on your chest, feel your chest rise and fall. So what happened there? The baby turned over, or whatever they said, right? And it's like, okay, so the next one's going to feel similar.
Get prepared.
I'm going to breathe with you. Back to the rule of 3. We know. So yeah, while I talk a lot about to my students that the midwife doesn't come in, you don't become the star or the center of attention in the room. The laboring person is the focus. When they have a moment like that, that's high volume or a little panicky, then I talk right to them. I get right down and we make eye connection, and I'm right there with them, just like a good doula, right? Some of our tasks overlap. So bringing their attention to their breath. And I don't know the author, and if you need to know, I can find out and email it to you or text it to you. It's a 1 minute, 1 moment meditation.
Oh yeah, you mentioned that in the other podcast. Yeah.
It is this process of taking what meditation is attempting to teach us about slowing our breath and calming our minds and all these things that are supposed to give us brownie points, and getting it down so that you're so good at it that in the course of 1 or 2 breaths or a minute, you can achieve that same goal of, I've already been meditating 20 minutes and I've solved everything in my mind and in the world, which I thought, how brilliant, because our central nervous system, our brain, doesn't know the difference between fact and fantasy. So if we can practice this idea of, in the course of a couple breaths, I can bring my shoulders down, I can bring my whole central nervous system back to, okay, we're good. Now, in about 40 seconds, I'm going to have another contraction. So let's see, what I can do about my breath to help my central nervous system stay calm rather than ricocheting around, which does waste energy, does make you doubt yourself. All those places that we really don't want somebody to go in labor, because what they're feeling and what they're doing is probably right unless something else is going on. It's just unfamiliar. I've always resented the pushing a baby out as pooping. No. It's an adjacent location, but the sensation is not like pooping.
Totally different. And I think that's why the practice is so good, because our life is so chaotic and is so busy that unless you have a regular meditation practice, when you can slow things down, do your visualizations, just breathe, your body and your mind become familiar with what it's like to do that. Because as you're adding intensity to a belly and those muscles are tight, the rest of you has practiced being loosey-goosey, rhythmic, long, slow, and deep breaths, giving oxygen to those tense muscles that are in the belly, doing what they're supposed to do, right? They're pulling up on that cervix. They're pushing that baby down to thin everything out and open it up. Like they're working according to plan. We have to get our mind and body connected beforehand, which is why we say, please practice. Like the more practice you have, the easier it's going to be to come back to it when you have those shifts in labor, or when something unexpected shows up, or when one of those tigers shows up that you didn't want to come into your labor, right? You just can't plan for everything. And you've got baby as the wild card for whatever they need to do in the moment. So having that practice and those neural pathways developed in your brain, which takes a lot of repetition, is why we encourage so much practice.
And what you're learning is muscle memory and familiarity. I don't know if I would use the word wild card with the baby. I would say the baby's the one in charge, and we often forget that the baby has the biggest vote in what's happening. If you just felt a sudden shift in the intensity of your contraction or surge, the baby needed to do whatever it just did, because the baby is intimately familiar with everything inside that little astronaut's capsule apartment. The baby knows exactly where the bones are, knows exactly what size its head is. It knows exactly how much molding it can do. It knows all that. The birth workers, and to some degree, the birthing body, are out of the equation until it's like, excuse me, I need you to move your leg because your hip bone is where my forehead needs to go. Now you're in the loop. You're in the equation. The baby's like, you want me to come down lower? I need more space. Please move your leg. The muscle memory part, the feeling familiar, is where all these layers of focusing on your breathing, the certain type of music, the certain words, the FM radio voice. We know that you can put somebody into a relaxed state in a regular conversational voice. You don't have to slip into breathing in and breathing out and allowing yourself to relax.
I call it my Jessica Rabbit voice. You call it your FM radio
Yeah,
voice.
my FM radio voice. However, if you've practiced that, regardless of what's going on, your body will go, oh, let me just get to my relaxed, I'm okay place. And the last podcast we did, I mentioned how out of control I get because I'm terrified of the dentist for reasons that nobody can point to. I have to take my CD player because I listen to Bella Ruth Napperstack. There's a name for you, but she's got Hypnosis for Surgery.
I'm just impressed that you have a CD player still that works.
I know. So you could download this onto your phone because, yes, I'm an old fart. I don't do every stinking thing on my phone. But I listen to relaxation. I listen to a voice that I know is going to help me not panic. I do a lot of breathing. And in fact, the person who cleans my teeth now recognizes she can watch my chest rise and fall in that reclined seat. And she'll say, are you okay? Because she'll notice my breathing is shifted. Then I learned another layer of coping that doesn't really have anything to do with breathing, but maybe it could. I read research about people who were truly tortured in military situations and wars, and why do some people have post-traumatic stress disorder and some people don't. And the common thread they found was that the person who could negotiate with whatever was happening didn't have post-traumatic stress disorder. And the one I remember the most was that the guy knew that they were going to burn his feet or whatever they were doing, that he made a deal with himself that he was going to breathe twice before he yelled.
Wow. So they negotiate.
I'm still going to feel what I'm feeling. It's still going to hurt me. I'm still going to hate it, but I'm going to breathe twice before I yell.
So they took back some control.
Exactly. So I started playing the game that they told me that this was a half-hour visit. And it's okay. What if they hurt me every 30 seconds? That's 60 hertz. Okay. And then I could look at my watch and say, oh, we're already 5 minutes in it, and they haven't even put the stabber in my mouth yet on my head. So I started negotiating with time and playing the game of, we know they're going to hurt me. How often are they going to hurt me? And that was my level of negotiation. And yes, I've joked that I actually have a vodka tonic in the car after we're done so that I can recover, but I don't drink. So that's not true, but makes everybody else laugh, because I've also noticed my uncomfortableness makes them uncomfortable.
Absolutely. Yep.
And it's like, that's too bad, because you aren't doing the negotiating and the breathing and listening and it's okay. You're okay. You're okay. You're okay. It's just the dentist. It's just a tooth. It's just whatever. But negotiating could work in labor.
Well, and I realized that one of the phrases that I teach is, you can do anything for a minute. And so as that starts to build up, they go, I can do anything for a minute. And they do it. And she's like, that's what got me through those intense parts. I kept saying, I can do anything for a minute. I can do anything for a minute. And so even when it was a minute and 10, her partner was saying 1 minute, 1 minute. He goes, I saw some of those creep to 1:30. And he goes, there's no way I was going to say,
let me just be a convincing liar. Yeah. That's funny, because when I show a normal surge pattern, particularly when I'm talking about what happens when you have an induction and what happens to the surge pattern because of drugs, and how nobody tells you that. But I also do a dotted line about halfway up that, look, you're still in the foothills. Yes, you're aware, but this isn't the hard part or the intense part. It's really only, and I would draw the line in a couple different places. It's like, where do we want to draw the line? The peak of this is only 10 seconds long. The peak of this is 20 seconds. If we do the halfway mark, it's 30 seconds. And then we talk about closer to being done, true transition, the looking for me, I don't like this anymore, I can't handle this. How many more of these am I going to have? I love that one. How many more like this am I having? And it's like, I love how focused you are in the middle of, I hate that. And just FYI to all of you that are listening as a midwife, when I hear that sentence, I don't like this anymore, or how many more am I going to have like that? The average time is 20 minutes in an unmedicated, unorchestrated labor. When I hear that, I check my pockets. I make sure everything's ready, because it's like, here we go. We're having a baby. And I often will say, this is as bad as it's going to be, 3 to 5 surges. I said, and then it's all going to shift. I don't tell them how it's going to shift, because we talked about it in class, but that's going to be the beginning of true pushing, which across the board is less painful and more satisfying. When I asked them afterwards, particularly first time, what was going through your brain? And the most typical answer was, I finally get to do something besides just breathe.
I get to push.
I get to physically do something. And it's like, first few times I heard that, I thought, how interesting that breathing through your contractions or your surges was annoying.
It's just tiring. It's tiring, and it's boring at the end, right? And you're just like, you want something to switch up and get this flipping baby out.
True. I had 2 or 3 clients look at me as they're sipping on their bendy straw and their water. It's like, why is everybody so freaked out about labor? It's actually pretty boring. You just wait for the next pressury thing to start, and then you focus on your breathing till it's gone, and then you do it again. If only everybody could approach their labor with that mindset, that it's not that big a deal.
Let me have you circle back to you drawing those lines, because you said, side note, you were drawing the lines on the contractions. So I wanted to bring you back to finish that thought.
Well, when you were talking about it's only a minute, some people might argue that depending on where you draw that line, it's only 10 seconds, 20 seconds, 30 seconds of the part that's demanding your attention and telling your panicky part, I should be doing something about this feeling other than just breathing in and breathing out. I always ask my clients when I first started teaching hypnosis, how annoying was I? To remind them at every contraction, allowing your breath, breathing in, breathing out, breathing in the red, breathing out the red, whatever the lines were. And what I learned from my clients was labor is one of the few places that you could have immediate amnesia. That some clients, it felt like every surge and hearing somebody coach them was the first time they heard those words. Or maybe the familiarity that if the midwife or the doula is not saying anything different, I must still be okay. I'm shocked at the number of times I learned because I sounded calm, nothing too wrong must be happening. I'm starting to wonder as we're having this conversation if all this focus on breathing, yes, you're oxygenating your muscles. That's critical. Your muscles will complain. We all know it when we go for a longer walk or a harder run or exercise. Your muscles start talking to you when they're oxygen deprived. So that's the basis of all of this is let's get the oxygen to the working muscles. And of course, now we've got a baby in the picture. So let's make sure there's oxygen crossing the placenta so that the baby can continue to help. If your baby weighs 7 pounds or more, FYI, the baby's doing 50% of the work of labor. When you have a 5-pound baby, your body has to do more work to get that little lightweight package out. When you have a 9-pound baby, sometimes that's why those labors are so fast. And people are going, how did she get a 9-pound? How did she get that watermelon through a straw so fast? 9-pound baby's doing a lot of work with you and for you. It's going, it's my birthday. I smell cake. I want out. Let's go. So all of this is to oxygenate the muscles. That's simple.
That's the thing. Breathing is so simple, but it's been made to be such a big deal. I think just because of the internet and teaching and books, and we have to write about it. But I don't think people that are still birthing in villages in high density countries that don't have all of this medical care and focused attention they just do it. They know what works.
If you're going to do the small village thing, let's talk about the lineage and the support.
That's true.
Depending on how small your village is and how third world country, you've got your mom, your sisters, grandma, great grandma,
aunties,
or there might even be the hut that is the woman's hut that no man has gone in there because that's where you have a baby.
The birthing hut.
Right. Think of what you've grown up knowing is there for you when you have a baby. So talk about decreasing the fear factor. Yes, it's going to be hard, but I'm going to be right there with you, honey. Versus my favorite sentence, we're the only mammal that relocates in the middle of labor. No other mammal gets in the car and drives to a facility filled with people that you've met once or twice. So that changes. I know when I go into a hospital, I watch my clients do it. I watched it in the ER when I worked at the hospital, that people start whispering. They're afraid to touch each other. There's a change in your behavior. And it's like, what's the bottom line there? And it's, are you afraid that somebody's going to call you on your behavior? So you're just trying to disappear and be quiet. You're accommodating them instead of I'm here to have my baby, get in my room and help me do this. I'm the one that's paying your paycheck.
It's so crazy because our breathing does change according to our fear level. When we are trusting
or expectation.
Absolutely. Absolutely. And we flow so much differently when we're working with our body in the present moment, even if it's not how we thought it was going to be, if we can stay focused on that. And breathing is one of the best techniques before you get an epidural. When I have a mom that says, I want pain medication, I'm like, okay, cool. It still may be an hour before we get that. They got to give you fluids. They got to do all this stuff. And if you immediately throw all of your tools out, it hurts 60,000 times worse. And so we just stay with the breath. We've got everything ordered. Focus on what we're doing, because those tools of the breath, which is all you can control in labor, is what's going to keep those intense pains away that would be even more increased if you just started going, where's my pain medication? You know, it makes everything bigger than it has to be. I feel bad when I hear some of my placenta moms that didn't take any education go in without at least the knowledge of their breath and fear and how their body works and how it helps with their hormones, which are actually governing their labor, because they could do this without suffering. It could be intense, but they could do it without suffering.
There's a key phrase. Just because it's big, just because it's intense, just because it's long, just because it's hard, insert whatever word you want, doesn't mean you have to suffer.
Yeah.
That's going on up here, how you're interpreting it. And I will say, back to your hormonal comment, when Sarah Buckley, who is an MD from Australia, did the hormonal blueprint of labor research paper, it changed the trajectory of my practice. It made what I saw in the labor room make sense, rather than the stuff I was taught as a midwife in training, and then what childbirth educators are teaching. And it might be, like you said at the beginning, the leftover Lamaze mindset of, we got to really focus on this complicated breathing thing or else you're going to feel more than you want. When she explained how all that works in the limbic system and your endocrine system.
Oh, it's so good.
Something as simple as asking the birthing person, do you need some water? When I learned that pulls them into their frontal cortex, like doing math, dampens down the hormonal cocktail for labor. It's like, I'm not talking to the client. I know there's no evidence of it here that I can be quiet, but I can be quiet. I don't talk to them until they look for me. They're already in their frontal cortex. They're looking for information. They're looking for an anchor. They're looking for validation. Until then, I would do all the midwifey, doula-y things to look and feel official and worthy, instead of just setting up my equipment and disappearing into the wallpaper until I'm needed. So hopefully my perfect birth is I'm not ever needed. Reach down, you feel your own baby's head crowning, you receive your own baby, bring the baby up to your chest, the baby's breathing, perfect. Not that I won't step in, but that's normal. That's what being able to breathe and keep yourself calm will get you. Part of the biggest thing that I had to let go of was that I had to have my fingers in somebody to understand what was happening. And I watch and watch and listen, and that tells you so much.
I think that's the perfect way to end the episode, because it's the perfect way to end the episode. It's inspirational. Go back to what we've always done. Your body can do it. Stay rhythmic in your breathing. Drop the fear and just let your body move forward. Gorgeous.
Your baby and your body know exactly how to do this.
And we will see everybody next week. Thanks for joining us today. And remember, it's your body, your choice, and finding your voice is your power. Be sure to subscribe to our YouTube channel, follow us in all the places, and go to birtheducationcenter.com for our blog and more online education classes. And we'll see you next week.